Today, we are going to look at the role of communications in healthcare settings. This is Debbie Rains, and I'm glad to be with you again. In healthcare settings, communications is vital because it impacts the functioning of the team caring for patients. Healthcare is a team activity. While caring for a patient, there are numerous handoffs between levels of care, shifts of providers from different disciplines. In addition, many diagnoses, therapies, procedures, and outcomes are dependent on accurate information. A missing lab value, lack of an accurate history, lack of timely action may all result in an adverse event. Finally, the reality that patients need care 24/7 requires the involvement of many providers in a person's care and makes clear communications critical to both continuity and safety. According to the Joint Commission, ineffective communication is a root cause for nearly 68% of all Sentinel events reported. This chart from the Joint Commission illustrates the significant role communications has in adverse events. As nurses, we like to complain about staffing. If only we had more staff, everything would be better. But look at the data. Staffing is very low, causing only 12 per 100 errors, whereas communications is well above every other cause of adverse events. Communication means to share. It is the activity of conveying information through the exchange of thoughts, messages, or information, including speech, visual, signals, writing, or behavior. It is the meaningful exchange of information between two individuals or a group of persons. One definition of communications is any act by which one person gives to or receives from another person information about that person's needs, desires, perceptions, knowledge, or affective states. Communications may be intentional or unintentional. It may involve conventional or unconventional signals. It may take linguistic or non-linguistic forms, and it may occur through spoken, visual, or other modes. There are a number of challenges in the healthcare setting which may interrupt effective communications. Let's look at these and how they impact safety in the environment. Distractions. Often a nurse is charting, listening to another provider, and knowing that they are needed in room 317 to help the patient to the bathroom. Meanwhile, the phone is ringing and the unit clerk is saying your new admission is on the way. Distractions can lead to miscommunications. The nonverbal cues a person gives off before ever speaking may influence how the receiver hears a message. Also, individual personality and styles of communications influence both the sending and the receiving of messages. Workload and the busyness of the multiple competing tasks, the nurse might think communication was effective when it was not. For example, the nurse tells the nursing assistant to take a patient's vital signs. The nursing assistant takes the vital signs and documents them on the chart. Later in the day, the physician approaches the nurse because he was not notified of the patient's elevated blood pressure. When asked, the nursing assistant points out that the nurse just told her to take the vital signs. The nurse never said she wanted to know what they were or a particular reading that needed to be reported immediately. It is important to verify what the other person said. This checks the accuracy. Did you hear the message the sender was sending? Also, by letting the sender hear their message again, it is another way to be certain that what was said is what was intended. The communication process may be impacted by your status in the chain of command. Not wanting to speak up or to question the information shared by others because they are higher in the chain of command can lead to problems. In the healthcare setting, effective communications needs to exhibit 4 attributes. It needs to be complete, providing all relevant information, yet avoiding unnecessary details; clear, conveying information that is understandable; verifying that what you hear is what the sender intended is part of clear communications; brief and concise, as well as focused on the issues; and timely. Delays in communication could be compromising. Communication needs to occur at regular intervals among team members. So what are some strategies that have the potential to reduce medical errors related to miscommunication? The 4 strategies we are going to look at are SBAR, callouts, checkback or readback, and the handoff. These strategies can be used by anyone on the team and should be used by everyone on the team. SBAR is especially useful when you're trying to communicate a complex set of facts so that the listener can make a decision. There are 4 parts to communications using SBAR. These 4 parts are situation, background, assessment, and recommendation. A call-out is a strategy used to communicate important or critical information during an event. To initiate a call-out, speak in a loud, clear voice, direct the information to people in the room, using a name if you want the attention of a specific person. For example, blood pressure 90/20, Lasix 10 milligrams given IV push, or decelerations more severe, heart rate down to 60, Lisa, a C-section room needs to be opened now. The checkback or readback strategy is used to close the communications loop. It occurs when the sender initiates a message, the receiver accepts the message and confirms what was heard. The sender then verifies that the correct message was received. A handoff is designated to enhance the exchange of information at critical times in a patient's care. A handoff includes transferring information along with the authority and responsibility for transitions in care across the continuum, such as between shifts, lunch breaks, transitions of patients between units or settings. A handoff also provides an opportunity to ask and respond to questions. At the end, the person handing off needs to get an acknowledgement and acceptance of responsibility for the patient from the person accepting the handoff. One's responsibility for the patient does not end until this occurs. In summary, being clear, concise, focused, and accurate are critical features of good communications. There are examples of communication strategies discussed in this presentation on the UB Learn site for this course. Please take a few minutes to review them. Thank you, and have a good week.